Well, tonight we're learning more about Eric Duncan's initial visit to the emergency room at Texas Presbyterian Hospital.
And that is when he was sent home with a prescription for antibiotics and advised to take Tylenol. We've learned Duncan's medical records released to the Associated Press by his family span more than 1,400 pages. Those records cover his first visit to the ER, his urgent return 2 days later, and the decline in his health until he died on Wednesday.
We know Eric Duncan's temperature spiked to 103 during that first visit to the emergency room. A measurement so shocking it was flagged with an exclamation point in his medical records. We also know that despite the fever, a physician's note said Duncan was, quote, negative for fever and chills. There are also still big questions about which hospital staff members knew what and when about Duncan's travel history to Africa.
Attention now turns to the 48 people being monitored after having contact with Eric Duncan. 5 of them are in quarantine. They'll also be closely watched for signs of Ebola for 21 days from contact with Duncan. That time period ends Sunday, October 19th. We have team coverage of all of today's new developments, including an interview with the man who could have been the nation's second Ebola patient. But let's start with NBC5's Ken Kaltoff. Ken, what is the latest on those 48?
The news is very good tonight. None of the 48 are showing symptoms, but there's new information about Duncan's care at this hospital before his death 2 days ago raises new questions for Presbyterian. His fiancée Louise and the other people who lived in the Dallas apartment where Thomas Eric Duncan stayed are the most at risk for Ebola symptoms. 12 days now after he entered hospital isolation, no one else has fallen ill.
But we have to stay meticulous, we have to stay focused, and we have to do everything in our power to keep people safe.
County Judge Clay Jenkins spoke at a special congressional hearing on Ebola. Before Duncan was admitted as an Ebola patient, he was sent back to the apartment from the Presbyterian emergency room.
But it would seem to me that much of what we are worried about right now could have been eliminated because the protocols were in place.
Because they confessed to a records error and then they've retracted that there was no records error. To me, it's hard to know what's going on there.
Medical law expert David Walsh says lawsuits against the hospital could be difficult because Texas severely limits emergency room liability and requires proving a patient had a better than 50% chance of surviving. Ebola chances are lower, but state and federal investigations are likely once the Ebola watch is over.
They're going to come circle back around and see what happened, and then there will be an investigation for sure into what happened, and then there's no telling what the repercussions could be because they let a patient go that they shouldn't have.
The hospital released another statement today saying that it continues reviewing Duncan's initial evaluation, but it is changing procedures to better screen for Ebola. It says that the hospital team is grieving but committed to sharing what it has learned here about Ebola. Reporting live in Dallas, Ken Kaltoff, NBC5.
Thank you.